For those of you who have already joined, we will be starting at the top of the hour. Thank you. For those of you who have joined, we will wait a few minutes for other people to get on, and we'll start at about 2 minutes after the hour. Thank you. For those of you who have joined, we're going to give 1 more minute and then we will start. Thank you. Okay, good morning. And thank you for joining us for our first Ask the Doctor webinar. My name is Carol Egan, and I work for Hammacher Schlemmer, specializing in pain relief and supplement categories. I will be the moderator today. Before we get started, I want to mention a few things about the webinar. The first 40 minutes, I will be interviewing Dr. Palmer, who you can see on the screen, asking him a series of questions about pain relief and specifically about how CBDa can aid in relief. At this time, at any time, you can type a question into the Q&A that is situated at the bottom of the page. You just need to hover over it to see it. My colleague Melissa will be watching your questions and organizing them so that we can answer them in the last 10 to 15 minutes of this call. We recommend that you wait till the later part of the webinar to ask your questions, as we believe we will answer many of the questions as we go along. On this Zoom call, all of the participants will be on silent and the chat function is disabled. The call is being recorded, and in the next few days, look for an email from Hammacher Schlemmer with copy of the recording. Additionally, it will be available on demand via our website. Finally, note that at the end of the webinar, we will have a special code to save on our pain-relieving Chylobinoid cream. Now, let's talk about what we are going to cover. In case you didn't know, Hammacher Schlemmer has been in business for 174 years. We've been selling the best, the only, and the unexpected since before the Civil War. With so many people experiencing pain, we started selling pain-relieving products in 1930. One of our best-selling pain-relieving items is our truck driver comfort cushion. And in recent years, we found that people were interested more in natural pain relief. In our quest to find new and innovative products, we discovered Chylobinoid cream that is made with CBDa. It quickly became a winner. We wanted to learn more, so we sent out a few surveys, and we discovered that our customers had a lot of questions. And they too wanted to learn more, which is the reason for this webinar. Some of the questions are on the screen, and these are questions people have asked. What is THC, CBD, and CBDa? What is Chylobinoid? Are these products safe? What types of pain can these products help treat? How do you use these products to get the most benefit from them? And what are other things that you can do to temper your pain? This morning, we are talking with Dr. Scott Palmer to answer these questions. It is our goal that by the end of our webinar, you will know more about these new treatment products and will have a better idea of how to treat your pain. Again, if you came on late, we will spend about 40 minutes learning from Dr. Palmer, and we'll have 10 to 15 minutes at the end for questions. You can submit your questions via the Q&A at any time that's at the bottom of the screen. Note that we are taping this session and we will send out the link after this meeting. And now let me officially introduce our special guest. Hi, Dr. Palmer.
Hi, Carol.
How are you today?
Good.
Great. So we've got a lot of information on the screen. I was wondering if you could tell us a little bit about your background and how you became interested in pain relief.
Sure. So I'm a board-certified internal medicine physician practicing at Rush University Medical Center in Chicago for about the last 30 years or so. And, I think all doctors are interested in pain management relief, both acute and chronic pain, because that's just part of our practices. That's what patients go through. I think, as we all know, the pain relief has evolved over hundreds of years. We used to apply ice to areas of our body. There was balms. There was discovery of other things like the morphine from the opium poppy. We discovered that aspirin products were in the willow bark. And more recently, we are using things like anti-inflammatory drugs, steroids, narcotic pain relievers, other medications. Certainly, there's a lot of great topical treatments for acute and chronic pain that we like to use as well. Interestingly, cannabinoids have always been known to affect pain perception. As we'll get into later, they've been used actually for thousands of years for pain relief and other medical applications. And as it turns out, as we've discovered over the last 50 years, they have a lot of anti-inflammatory effects. They also have direct analgesic effects, and they can also be used for other medical issues that patients have. And that's what's so exciting about this field.
That's great. Before we get into some of all of those specifics, I did want to ask a little bit about your background with the Chicago Bulls and the Chicago White Sox, just because I know a lot of people might be interested in that. Can you just speak to that a little bit?
Sure. So in addition to being an internal medicine physician, I started working as a medical team physician with the Chicago Bulls and Chicago White Sox. And it's been actually a great experience. I've learned a lot. The experience has taught me a lot about nutrition, exercise, things like sleep, preventive treatments, therapies, and how to manage pain in both in athletes and in really active individuals who want to be active and participating in their healthcare.
Are those sports teams able to use these types of products that might come from hemp or marijuana?
Well, that's a good question. I think this is in transition. I think that globally, CBD now is recognized as a safe product, and many world sports organizations are allowing the use of CBD. I think that in the United States, in major sports, people are looking at this as a possibility. Certainly, before any product is used in a locker room or by athletes, it's got to be certified independently as being pure, without any contaminants. They look at as to the way it's made. And I do think that in the years ahead, that cannabinoid products will be used by professional athletes and in the locker rooms of these teams.
But right now they can't, correct?
Currently, not. It's because I think there's still concern whether or not there's any contamination with THC and those products, despite the fact that we know that CBD and all those other cannabinoids are very safe and very efficacious. But I do think that the people have come to realization that this can be a significant part of pain management and can help athletes recover from injury and just game to game stress that they go through.
Right. And how did you get into the CBD and CBDa world?
So originally I co-founded a company years ago called Synthonics, and we got into an area where we were improving the pharmacokinetics of FDA approved drugs using something called metal coordination. And so we didn't actively seek out to get into the cannabinoid space. As it turned out, acid cannabinoids, which are actually the ones produced by the plants themselves, are very excellent coordinators of biological metals like magnesium. So we discovered, and this is about 7-8 years ago, that we were able to take high quality hemp, use our technology, and combine the CBDa produced by the hemp with magnesium to produce this stable product, which was a powder. And it also had other great properties, like it was water soluble, and we could put it into creams and capsules and now in other products.
That's great. So we are definitely going to talk more about that. Before we get into kind of that depth of that, I wanted to do a poll, which we are going to talk about. The topic of this webinar is, do natural pain relievers really work? So to begin, we're going to do a poll that you will, to see what types of pain relievers people are currently using. The poll is going to pop up on the screen, and you can select multiple answers and then click submit. So here we go. I am going to put a poll up. This is, what types of pain relievers do you use? And you have a few seconds to read through these types of pain relief that you might use and select all that apply. And then when you're done selecting the ones that you are using, if you could click the submit button at the end. Just waiting for the participants everybody to have a chance to read through these, and then I will share the specifics. I see a lot of people writing in, putting in answers, and I really appreciate everybody taking the time to read all of these. And again, you can do multiple choice and click submit. Got a few more people coming in here. All right. I am going to end the poll and then I'm going to share it with everybody. Okay, so here's what we have of the people who are participating in the poll. 97% selected non-prescription pain relievers such as Advil, Aleve, Tylenol. 32% selected a pain relieving cream, lotion, or gel. 35% a pain relieving patch. 12% choosing prescriptions. 44% choosing CBD or CBDa. 21% choosing other natural pain relievers, 32% choosing anti-inflammatory, and 15% selecting acupuncture, dry needling, or cupping. So those are some great pieces of information about what people are using right now. I'm going to stop sharing. Just want to say thank you to everybody for sharing that information. It's good to see that some folks are already using natural pain relievers. Today, the natural pain relievers we're going to discuss are CBD, CBDa, and Chylobinoid. But before we can discuss this, we want to give a little bit of background on hemp and marijuana and how those differ. So we're going to, here we go. Dr. Palmer, can you speak a little bit about the differences between hemp and marijuana?
Sure. As a preface, cannabis has been around for thousands of years. It's a very interesting product. It sort of originated in Asia and was used very early on by different cultures for various reasons, both for medicinal, for spiritual, religious purposes. And it was used by a wide variety of cultures. It was ultimately brought from the Far East and Asia into the New World, probably around the 1500s. And with time, we began to understand that even though that hemp and marijuana are the same plant species, they did get differentiated based on their strain. They have different characteristics. Basically the hemp products were very low in THC and very high in the CBD products. They were also had other benefits. They were used, as mentioned here, as in clothing and food and paper, industrial products, whereas the marijuana plant was very high in THC and was used for that purposes traditionally. And also they noticed that it had a lot of other, some medical as well as the recreational uses.
Can you just explain what THC is for some people?
So THC is the molecule that is produced from THCA. So there's a difference between what we call neutral cannabinoids, which is THC and CBD, which we typically know, and the acid cannabinoids. Those acid cannabinoids are actually produced by the plants themselves. So very interestingly, of all the hundreds of cannabinoids in the cannabis plant, both in the hemp and the marijuana, there's only one that produces that high sensation, that psychoactive sensation, and that's THC. And I think that's how we sort of remember marijuana is that when you consume it, typically people would smoke it, or you could even consume it in edibles. What you were actually consuming was the THC, which gave that effect. And now, as people know, you can get THC containing products in dispensaries, and it's a massive industry now, at least in the United States and Canada and across the world. And then evolving parallel to it is this very interesting CBD and CBDa market as well.
So you cannot really get high off of a hemp product.
No, by law, federal law, the content of the product has to contain less than 0.3% THC. So a very good question, a common question is, if I consume hemp-based products, would I get high, or would it alter anything that I'm also already taking? Could it, if I was drug tested at work, would that show up? And the answer is no. The hemp products are extremely safe and contain effectively no THC.
Excellent. So now that we understand a little bit about hemp and marijuana, let's talk about the differences between CBD, CBDa, and Chylobinoid and how those differ. Could you explain that a little bit to us?
Sure. So CBD is what I think people are most familiar with. It's what we call a neutral cannabinoid. It is sort of the product of extraction. So in the conventional sense, people take hemp products. A lot of people do it themselves. There's companies that also harvest their hemp, and they produce CBD after it's the end product of an extraction process. And as you can see, it's CBD has excellent properties. It can result in reduced inflammation. There's a FDA approved CBD called Epidiolex, which is used in childhood epilepsy. It's the basis of a lot of companies that grew up like Charlotte's Web. Charlotte Figi was a child whose mother sought out ways to improve her epilepsy and came to discover that products with high in CBD and actually probably CBDA were able to help to suppress her epileptic seizures. The problem with CBD is that it is only fat soluble. It does not dissolve in water or in aqueous solution. So the bioavailability is only 6 to 8%. So if you consumed, let's say, 100 milligrams of CBD, only 6 or 8 milligrams of that is going to get into the bloodstream. So that, by definition, requires a large amount of CBD to be consumed to get into a good therapeutic range. CBDA is what we call one of the acid cannabinoids. You know, its cousins are THCA, which is produced mostly in the marijuana plant, and actually the mother molecule, which is CBGA, which is sort of the mother of all the cannabinoid products. But CBDA is, as mentioned, is the precursor to CBD. It's extracted, it's present in the raw plants. It is a much stronger mediator of inflammation. It's in studies, it's probably about 1,000 times as potent as CBD on receptor sites. And it has significant amount of greater bioavailability. So, you know, whereas there may be about 6 or 8% CBD available, CBDA is about 4 times greater than that. Our Chylobinoid, though.
So just to clarify, so CBD is really just is extracted from CBDA.
Right. It's the end product. Once there's a carboxyl group that is on the CBDA that's removed through the extraction or through drying and in other processes. You know, recently CBDA was just thought to be an inactive precursor to CBD. So there was no desire to actually try to use CBDA.
Right.
In fact, for years, people said, why? So who cares if you got CBDA? But as it's turned out, CBDA has very potent properties, which we're now exploring. So Chylobinoid is our product. So what we effectively do is we take very pure, high quality hemp that again has less than 0.3% THC in it when we harvest it. And we use a very, very simple green extraction process where we combine the sort of an extract from it with the magnesium, and it produces this powder, which is really a micellar form We call it micellar magnesium CBDa, or cannabidiolic acid. So this product is what we actually take and can produce creams, which of all variety of creams and balms. We also produce capsules because being a powder, we don't have to use oil. A lot of people consume CBD through tinctures of oil, but because we can make a powder that's water soluble, we're able to formulate it in the form of a capsule. And as we've discovered, it is about 8 to 10 times more bioavailable than CBD when you consume it orally.
Right. And so since we started talking about that, let's go a little bit deeper into what makes that chylobinoid a little bit different, because there are definitely differences. And if you could, we've got a bunch of different differences here.
Sure.
Can you speak to these and just number one, how is it, extracted, refined, and I know it's made in the US. You've mentioned that as well. Could you speak to that a little bit?
Yeah, our plant is in Virginia, outside of Blacksburg, Virginia, and our facility is food safety certified by the Virginia Department of Agriculture. It operates under the FDA's CGMP guidelines for dietary supplements. And CGMP simply means that it's a current good manufacturing practices, which is a certification that is important because it adheres to FDA guidelines about producing such products. So we make this pure magnesium CBDa. It's grown from US hemp that we purchase. As I mentioned, part of the process is we combine it with magnesium, and there's a lot of reasons for that. Number one, magnesium will stabilize the CBDA. The CBDA, the acid, is actually pretty much unstable. If left on a countertop for a period of time, it breaks down into CBD. In the old days, that's what people wanted. Now we understand that CBDA has a lot of great properties. So the magnesium will stabilize it. It will increase its water solubility. And magnesium also can help with things like tissue penetration. When it's in the cream, it can help with absorption, deeper penetration. And we believe that also when consumed orally, that the magnesium may help to the CBDA to penetrate into tissues when it travels via the bloodstream or the lymphatic system.
And now all of this goes through an inspection process?
Yes, as I mentioned, it's a food safety certified process, and the Virginia Department of Agriculture certifies our facility to be sure that we adhere to quality control. So so that assures that the product is pure, it's consistent, it has no contaminants.
And so you had spoken earlier about it being 10 to 100 times stronger than CBD. Can you explain that a little bit?
So this is the issue is that CBDA was discovered years ago in animal models to be about 1,000 times as potent as CBD. And the model was an animal model for nausea. So it was remarkable that CBDA at tiny, minute quantities was far more potent than CBD. As we've discovered with time, that when we compare, for example, we've used our oral CBDA, our Chylobinoid, in patients with refractory epilepsy. And what we found was that whereas they would require, like say, 2,000 milligrams of the CBD in the Epidiolex that they would get, which is an FDA-approved drug, they only needed about 100 milligrams of our product to give the same effect. And this is just borne out both in other research and more animal research. And we are currently pursuing studies that will show how well it's absorbed and how it compares to CBD in the bloodstream.
And what does patent pending mean?
So patent pending means we, Synthonics, we have many, many patents of our metal coordinated technology, and the application of this to the acid cannabinoids, we wrote a patent application, which we submitted in 2019. So it's going through the patent approval process, which is a long process, but effectively we are the owners of the metal coordinated acid cannabinoid group, which is inclusive of not only the magnesium CBDa, but other acid cannabinoids like THC and such as CBGA.
Got it. So we're going to talk a little bit in a minute about the how this cream and the capsules will help with pain. But before we do that, I want to actually ask people and do another poll and get some feedback from the audience. So I'm going to launch a poll about what types of pain you have. In surveys that we've done, a lot of people tell us where their pain is. They will tell us that they have back pain or knee pain or neck pain. This question that I'm going to show is about what type of pain you have. And you may actually not know. So we have included a choice that says, I'm not sure. Again, you will be able to click on multiple answers and then click submit. So let me put this poll up. It's again about types of pain. I have launched the poll, and we will see what types of pain people are experiencing. And I'm sure that most people are on this call because they have some type of pain, as do many people, all different types of pain. One of the things that there's some different types of pain actually that are not listed here. I do want to mention some of that at the end. So thank you, everybody who looks like you're putting in some more answers. Again, remember to hit the submit button when you are done doing your selections. I know personally I would forget to do that myself. All right, I think we have most of our answers. So let me end the poll and let me now share those results. So interestingly, we have 58% with muscular pain. We have 61% with arthritic and joint pain, 19% with neuropathy or nerve pain, 50% with inflammation, 19% with sore, dry skin. Some people didn't even know you could use this cream for that. And 11% who say, I'm not really sure. So we'll definitely try to cover different ways of speaking about this different types of pain. So thank you, everybody, for contributing to that. Okay, we are going to move on now. And actually, we're going to talk about those different types of pain and how the cream can be used on those different types of pain. So Dr. Palmer, if we could kind of hit on each one of these, because each person, as you can see, is experiencing different types of pain, what this pain is, a slight, I guess, description of what that kind of pain is, which may help people know what they've got. And then also how the cream or even the capsules that Hammacher does sell can be used to treat that. Sure.
So neuropathic pain is effectively, it's sort of a due consequence of injury to the nerves, the peripheral nerves. And typically one of the things that people are classic for neuropathic pain is diabetic neuropathy. So people with long-term diabetes can describe this sort of achy, burning sensation. Maybe it's a coolness, can be in their feet, track up their legs, can be in their hands, but there's a lot of other types of neuropathic pain. You can have neuropathic pain after an injury, due to medications, people after chemotherapy.
Yeah, I was just going to say chemotherapy as well.
Right. So the arthritic pain, obviously, is the degenerative arthritis is sort of the arthritis of aging. So that wear and tear with life and past injuries or just being active and athletic. You can develop changes in the joints and the muscles, the tendons. So when we are trying to be active and moving, like getting back out on the golf course or getting on a bicycle on a tennis court, you can get the aches and pains in the knees, the joints, the shoulders, and the back. And that sort of is similar to the muscular pain because muscles and joints sort of work together. And people with,
go ahead.
well, people with arthritic joint pain typically describe the same sort of muscular pain as well.
And how does the cream that we have help to treat those types of pain?
So, right, and it works across the board here, both for the general inflammation or even the sore, dry skin. But as it turns out, the cannabinoids have very powerful effects, basically because we evolved with the cannabinoid system in place. There's a system called endocannabinoids that we evolved over tens of thousands of years that the body used to modulate lots of things like our pain, our immune system, anxiety. That's why these products work in patients, because we're sort of pre-wired to respond to them. So there are receptors in the body, CB1, CB2, and others, that these molecules can affect. Now, interestingly, CBD and CBDa don't directly affect these specific receptors. They can affect a lot of other receptors, like the serotonin receptor, which sort of mediates things like depression, anxiety. Also can affect, modulates migraine headaches. It also can modulate the COX-2 receptors, which are very involved in inflammation and pain. In fact, drugs that we know of, like Advil, Aleve, diclofenac, indomethacin, those relieve our pain and inflammation by affecting those COX-2 receptors. And in fact, in early studies back in 2008, they found that CBDa is about as effective as diclofenac and indomethacin in inhibiting that enzyme and reducing pain. It also hits other receptors, very complicated receptors that we're now learning about, which make it very interesting to both have direct analgesic properties, meaning reducing pain, reducing inflammation. These products, both topically and orally, are antioxidants, so they can help repair damaged, injured cells. It can also help to reduce the inflammation associated with tender skin, like people describe sometimes having atopic dermatitis or psoriasis or dry skin from the sun. And the CBDA definitely can reduce that inflammation, be more soothing, and that tenderness can be markedly improved.
So if I was a person who had, let's say, arthritis in my knee, I might have pain from bone on bone touching, but I may also be having muscles that are strained around that area and then inflammation around that area, correct? So
right.
The cream is going to be aiding kind of all of those things. How does that work?
So, well, the nature of the cream is obviously the skin is a barrier to entry for everything. So when we apply things topically, there's a degree of absorption, and that's why, we've worked in our Chylobinoid cream is very good at penetrating to deeper levels of the skin. And we know there are receptors on the surface of the skin that moderate pain. Pain that originates though in the deeper joints, they're deeper, and it may take more time and more application for those receptors, the deep receptors, to be affected. But in our experience, when people apply the cream to painful joints and muscles, they see an effect typically in about 15 to 20 minutes, which is actually pretty prompt, as this slide shows. And that pain relief can last anywhere from 48 hours. And over the next couple of days, that pain relief can actually be increased, since it is an anti-inflammatory, and anti-inflammatories can work both immediately and and over the span of a couple days.
Right. So this gets to a little bit about application as well, which is on the next slide. And um, one of the things you were talking about was it lasts about 4 to 8 hours. One of the questions we get is, how often can I take this or use this product? How often can I apply this cream?
So the cream can be applied as often as someone would like. I tell people that they don't have to apply a large quantity to the painful area. I tell them give it a chance, 10, 15 minutes to be absorbed and to reduce the pain through affecting those receptors. But that people will say, yeah, that suddenly the pain is markedly reduced. Sometimes they have to apply more frequently depending on the depth of the origin of the pain. But people's response has been very good, and that pain relief can last 4 to 6 hours when they can then reapply the cream if they'd like. But it's up to them.
Can they use it indefinitely if there are people who have chronic issues that they may never be able to have go away? Can they use the cream indefinitely?
Right. So the product is very pure and natural. There is no reason why they can't keep using it, applying it on a long-term basis. Someone who noticed that there is a response may also benefit from the oral capsules, which give more systemic release. And so people describe being on, they can actually take both. You can take the oral medication, the oral capsules, and use the topical cream. And there's other formulations that we're working on. There's a balm, obviously, that's, I think, very convenient to use. Let's say you're going to go out to, be active and don't want to wait for the cream to dry. I think the balm is a nice way to apply.
Right. I can tell you I've used both and they're both wonderful. Okay, so we're going to dive into some questions from the group. So if you have a question, just a quick reminder that you can ask those questions at the Q&A at the bottom of the screen. You just need to hover over that. Also a reminder that after the Q&A, we do have a special offer for the trial size of our CBDa cream that comes also with a body balm stick. We'll have that in a minute. But Melissa, I know that you have been tracking the questions and was wondering if you could ask the first question for us.
Yes, we've had some great questions come in, so we will get started. How does CBD compare to Tylenol and Advil?
So Advil, which is acetaminophen, Tylenol, which is acetaminophen, is a very good pain reliever. It's analgesic. It is not an anti-inflammatory. The value of acetaminophen, the Tylenol, is that it's very easy on the stomach. It's good to reduce fever. It is also good for aches and pains. The Advil family, which includes Aleve, these are what we call the non-steroidal anti-inflammatory drugs. I think that the mechanism is more akin to what the Chylobinoid does. They both inhibit this COX-2 enzyme and reduces inflammation directly at wherever the inflammation is arising from, whether it's in a joint or a muscle or a toe or a shoulder pain. So I would say that the Chylobinoid is more akin to Advil, Aleve, and those products.
Thanks.
Great. Next question is, what % of oral bioavailability is Chylobinoid than CBD?
So the preliminary studies show that CBD, whether you take it by tincture or any types of products that are out there these days, variably, I mean, there are some newer formulations that may increase it a bit, but probably the oral bioavailability, meaning the percentage of the product that's absorbed through the GI system, is around 6 to 8%. In our studies, our product, when consumed orally, is about 10 times greater. So maybe 60 to 70% it gets into the bloodstream. And
that's a big
difference. Not only bloodstream, but it's probably absorbed through the lymphatic system which it also brings it to tissue areas where the CBD may not get to.
Excellent.
How do you avoid gut issues when ingesting magnesium?
Well, that's a good question. Magnesium, which is a cation, and it's a natural cation, one of the adverse effects of magnesium can be diarrhea. In fact, that's why we use things like milk of magnesia, magnesium citrate. Well, the amount of magnesium we have in our product is so low comparatively that we do not see any adverse effects at all with consumption of the magnesium CBDa.
Great question, though.
Is there a different reaction on the origin of the pain, for example, accident or age-related?
So let's say an injury versus just like a aging pain issue. So, injury typically results in tissue damage. And with tissue damage, there's oftentimes can be scar tissue, which is sort of a different phenomena. There's a repair mechanism that the body goes through with these injuries. So that in itself can set up, a different type of pain and pain response. Interestingly, we are interested in pursuing a use of the cream in burn patients. We have an upcoming trial that we hope to pursue use of our cream in patients who suffered third-degree burns. So that would be typical for that, kind of severe injury that the Chylobinoid could potentially treat. But as far as conventional degenerative arthritis and pain, it works very well, and it's the same receptors that are affected in that gives our brain that feedback that we're going through pain, and the Chylobinoid certainly can help reduce that pain.
Great. Are there any possible side effects of using CBD or CBDA, and can I use it with Advil?
The answer to that is yes. And that's also a very good question. Back in the days when we started using this product, we were because it was such a new product, we were very careful and concerned when we started to use these in patients. We used very, very minute doses, and we would do testing on, kidney function, liver enzymes, blood testing to be sure that there was no adverse effects. We were very, very encouraged by the work done by the company GW Pharmaceutical, which made the Epidiolex and CBD, that there was really very, very minimal side effects. As it turns out, there's very few interactions with other medications. So when people ask, can I take this with my prescription medications? For the most part, yes. We always will tell people to, maybe run this by their physician just to be sure. But typically people can consume the capsules or the cream with other medications with no adverse effects, and that includes Advil as well.
This one ties along with this slightly, but is there a recommended dose when taking orally?
So this is something we've learned over the years. What we've discovered is there is probably a level where the drug is most effective. I think it's sort of a linear relationship, meaning the lower doses can have some effect and the higher doses can have better effect. But this is complicated a little bit. CBD has sort of a biphasic effect. Interesting. So low levels aren't quite effective. High levels, medium levels are, but then higher levels of CBD may be less effective. I think we've discovered that our product, the greater consumption, the greater levels in the bloodstream can be more effective. And in more severe patients, we have gone up to as much as 500 milligrams a day of the Chylobinoid capsules, and have shown improved efficacy at those levels when they're consuming it for much more serious issues. I think that if someone was to start the Chylobinoid capsules, I will recommend people will start maybe 40 milligram capsule once a day before bedtime, just see how they respond, and then go to 40 milligrams twice a day. We do make a 100 milligram capsule, but I suggest that people start at the 40 just to see the effect and to slowly titrate themselves depending on the response.
Would you suggest starting off with a daytime and a nighttime dosage, or just one or the other?
Well, people can, because there is, so an interesting question that comes up is, is CBDa sedating? And the answer is really, it's not. So people, if they wanted to take it in the morning and the evening, that's fine. I mean, they can take that initial capsule in the morning or evening, whatever is most convenient for them. But I do think that twice a day dosing, I think, is a good start in general on the 40 milligrams, and then they can decide to go up based on their response.
Great. Can the cream be used for sunburns or eczema?
So yes, actually, a lot of people have tried the cream since it is anti-inflammatory. We've had some interesting stories about people who've used the cream after being out in the sun, sort of after being outdoors all day long. It's because it has a lot of natural shea butter products. It's very soothing. It's an emollient. It's very natural. It can reduce pain. It can reduce inflammation. I had a patient who said that she used it after she had a tattoo placed, and so she said it worked great to reduce that pain from the tattoo. But you know, it's sort of like it's so exciting because we don't know. There's not really a limit as to what we can use it for yet. It's really is only limited by our imagination as to what we can use these products for.
Next question is, if I use CBD long term, does its effectiveness dwindle over time?
I think that the initial data is that it does not. I don't know if we know. I would tell you that, you know, it's been a difficult path to study these products, because up until recently, studying these products was effectively illegal. You know, there was a time when there was only one university in the country that was able to supply research laboratories with marijuana. A lot of the research occurred in Europe and Israel and Canada. I think we are now learning much more about it. One interesting story is probably the most prevalent cannabinoid on the planet is THCA, which is simply in the marijuana leaf. If you were to consume a THCA leaf, you would get pretty much all THCA, but possession of the molecule itself by a laboratory of pure THCA is illegal, because THCA still falls as a Schedule I controlled substance. So I think that we are waiting for Washington and federal guidelines to help us continue to study these products, because I think THCA has terrific potential, does not get people high at all, but may independently have very unique properties similar to what CBDa has.
So in essence, we really don't know enough yet to know about if the effectiveness would dwindle over time.
I don't, in our experience, it has not diminished. You know, the issue is sometimes the process gets worse. So do you need more because the process is worse? I think that we've had patients on it for years and years and years, and have been on the same dose. We have one patient who had very refractory epilepsy due to a brain tumor, and she was finally controlled with a combination of a prescription medication and our capsules. And she recently told us she's going back to work after 7 years because she is seizure free. So
wow.
Her dose of the Chylobinoid capsules has been the same over the last 5 years.
That's great. That's good. Melissa, we probably have time for maybe one more question.
Okay. How about, will your CBDA capsules or cream relieve my pain faster?
I would tell you that the cream may have more local benefits. I think long-term, the capsules can provide more systemic distribution of this and maybe help with aches and pains, like if your body, you're all achy all over. I think the capsules would be a really good option, and you can also use the cream for more localized problems.
And I just have one more question myself, and that's regarding on the screen, you can actually visually see the creams versus the body balm sticks. What are your feelings in regards to how those are used differently and effectiveness?
I think the cream may be more potent as far as the distribution of the product. I think the balms, which I really like, are great to put on, areas of the feet or hands and shoulders, quickly absorb, can be simply rubbed in. And so I think depends on what you're using it for. I think both products have great potential depending on how you want to use them.
Excellent. And now we're just going to go to the last slide. And number one, first, Dr. Palmer, thank you very much for joining us today.
Thank you.
Really appreciate you being on and answering all these great questions. Thank you to all of the participants on the call and for all your good questions. Finally, as our way of saying thank you, we have a special offer to purchase our trial size jar and our body balm stick that we just showed you on the previous slide at 50% off. You can search our website for T4005 or use the URL that's on the screen, hammacher.com/webinar. A reminder that the link to this webinar will be sent out via email in the next few days. Thank you again. Thank you, Dr. Palmer, again.
Thank you. Thank you, everyone.
And everybody have a pain-free day.